Here's an example of an interaction with a patient whose responses to the alcohol screen and brief assessment indicated risky drinking without serious negative consequences or dependent symptoms.
Hi, Josh.
Hi.
Hi, my name is Mia, and I'm the health educator here at the clinic.
Okay.
Your provider's running a little behind today.
Okay.
So I figured while you're waiting to see her, I would come in. And part of my job here is to go over these healthy lifestyle questionnaires.
Okay.
And I see you completed yours at the front desk. Thank you very much. So if it's all right with you, I'd like to just go over this a little bit. And just to let you know, we're not going to hold up your visit with your provider in any way. So when she's ready to see you, she's just going to knock on the door and let us know.
Perfect.
Okay. All right, so just looking over this, I'll just go through the 4 categories that are on here. For tobacco, it looks like you marked in the past month no tobacco use.
That's correct. Never.
Okay. And never used any
Never.
tobacco.
Nope.
Great. That's a really smart choice for your health. And thinking about tobacco, thinking about both smoking and chew tobacco. Is that okay? All right. And the next section asks about alcohol. And so here, under the section for guys, you found that correctly. And you indicated in the past year you've had 5 or more drinks about 1 to 3 times a month. And can you tell me a little bit more about that?
So usually it's on the weekends. I work during the week, 3 days a week, and then the weekends my friends are off, so we usually go out and have some drinks.
Okay.
Usually, mostly Friday nights, sometimes Saturday nights. But by the time you go out with a group of guys, everybody buys around. You usually have 5 or 6 drinks. Sometimes more, sometimes less, just depending on how many guys you go out with and how long I'm out.
Yeah, so it's really part of like your socialization, hanging out with the guys. It's the weekend, you're kicking back.
Yep, exactly. It's an opportunity for us to get away from our wives and just have fun.
Have some guy time.
Yep.
Yeah. And so that's typically around that 5 drink mark, sometimes more, sometimes less.
Yeah, there's definitely been times that it's been more.
Okay. Right. And the next section here is drugs and prescription medication. And so you marked never for in the past year, no use of illegal drugs or using any prescription medication other than as prescribed to you.
That's correct.
Okay. And mood, it looks like in the past few weeks, no problems with feeling down or having loss of interest in things, things not feeling like fun anymore.
Nope, not at all.
No problems in
not
there.
at all.
Okay. So overall, it looks like making a lot of really good choices about your health. I would like to talk with you a little bit more about the alcohol. Would it be all right if we look over a few more questions?
Sure.
Okay. So this questionnaire is standard,
Okay.
and it just helps us get a little more of a full picture of what your drinking patterns are like and how that may fit in with your overall health.
Okay.
Okay. So for these questions, there's some different responses, and I'll let you know. For the first question, it says, how often do you have a drink containing alcohol? And this asks you to think about within the past year. So the response choices are never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week.
Probably 2 to 4 times a month.
Okay. And the next one says, how many drinks containing alcohol do you have on a typical day when you're drinking? So 1 to 2, 3 to 4, 5 to 6, or 7 to 9, or 10 to more. And I guess before I have you answer that, I want to go over with you what I mean when I say drinks.
Okay.
So I'll call your attention up here to this a single standard drink. So when I say a drink, I'm kind of talking about these standard drink sizes. So for beer, that's about 12 ounces of beer, so a can of beer size. If you're drinking hard alcohol, it would be about 1.5 ounces. That's usually a typical standard shot size. If you're drinking wine, it's that 5 ounces, so about the wine glass filled, kind of to the middle mark.
Okay.
So thinking about those standard drink sizes, is that, were those kind of what you were thinking before when we were talking about those 5 drinks?
Well, if we drink hard alcohol, I guess we just assumed that it was 1 drink. Like if you had a Long Island, that's a drink.
That counts as a drink.
Yeah.
Yeah.
But looking at that chart, I realized that there's 6 different types of shots in that Long Island, so that's actually 6 drinks.
Yeah.
So
Yeah.
It could change, but within the last month, it's still probably only been 5 or 6
Okay.
on occasion.
Okay, so thinking about in that frame of the last month, about 5 or 6. Thinking about overall in the past year, is that still in the 5 or 6, or would that number be a little different?
Still probably consistent with 5 or 6.
Okay. And that's on a typical day.
Yep.
And then the next question says, how often do you have 4 or more drinks on one occasion?
Probably monthly.
Okay.
Not very often do I go out and have less than that. It's
Okay.
usually right around 4 to 6. So
Yeah. So typically when you go out, it's in that 4 to 6 range, and you go out about once a month.
Yep.
Okay. And then the next question, and so for the next kind of chunk of questions, the responses are never, less than monthly, monthly, weekly, or daily, almost daily.
Okay.
So for the next one, it says, how often during the last year have you found that you're not able to stop drinking once you had started?
No, never.
Okay.
I usually can tell myself to stop. Like
Yeah.
if I have to drive home, I stop before I have to drive, so it's never a problem.
Okay, so there have been times that you've really put your mind to saying,
Yep.
like, I'm going to stick to this many drinks,
Yep.
and you've found that you're really able to do that.
Yep, exactly.
How often during the last year have you failed to do what was normally expected of you?
What do you mean by that?
It's usually asking a little bit like after a night of drinking or because you've been drinking. So some examples of that might be if you were out one night at the bar with guys and then you were supposed to show up and do something the next morning and then you didn't because you were so hungover. Or kind of maybe you were supposed to head home by a certain time but you stayed out at the bar drinking longer, that kind of thing.
I don't think it's ever been a problem.
Okay. And how often during the last year have you needed a first drink in the morning to kind of get yourself going after a heavy drinking night?
Never.
None. Okay. And how often in the last year have you had a feeling of guilt or remorse, feeling bad after drinking?
No, never.
Okay. And how often during the last year have you been unable to remember what happened the night before because of your drinking?
I don't think I've ever had that problem either.
Never had that happen.
Nope.
Okay. And these are the last two.
Okay.
So have you or someone else ever been injured because of your drinking?
In the last month or last year?
Well, it asks about ever,
Ever.
and then also whether that's been in the last year.
Probably yes.
Yes? Okay. And was that in the past year or longer ago?
It's actually the other weekend. So
Okay.
yeah.
Okay, so yes, and in the last year. Tell me a little bit about what happened.
We were just out canoeing and had a few too many drinks and we weren't paying attention. We ended up flipping the canoe and my buddy hit his arm on the rock and ended up breaking it. So
Oh gosh.
it could have been worse, but it kind of made you think a little bit. So,
Yeah. Yeah, so thinking, it wasn't as bad as it could have been. Nobody drowned or
Right.
anything. But on the other hand, you're kind of thinking, gosh, maybe we shouldn't have been drinking quite so
Yeah.
much in the canoe.
Yeah, because we actually had to stop canoeing for the day and we had just kind of only been halfway on our trip. So
Oh,
it
kind of
put a damper on the day, but everything was okay. So
Yeah, kind of ruined the fun
Yeah,
at
it
that
did.
point. Yeah. Well, I'm glad he's okay.
Yeah.
Glad it wasn't worse than it was.
yes.
Yeah. And then this last one here says, has a relative, friend, doctor, or other healthcare worker been concerned about your drinking or suggested that you cut down?
No.
Okay.
No, not a problem.
And that's never happened?
Nope.
Not in the last year. Okay. All right. So if you just give me a minute, I'm going to score this up,
Okay.
and then it'll give us a little bit of feedback that if you're interested in, we can talk about. Okay. So would you be interested in hearing the feedback based
Sure.
on the way you answered these questions?
Sure.
Okay. So it says you notice I wrote a 10 here, and
Okay.
that probably means nothing to you.
Right.
So what a 10 means to me is that your drinking is falling into the category of what we would consider risky drinking.
So it doesn't mean perfect score.
So it's not a perfect 10. A perfect score would probably be 0.
Oh, okay.
But what that means with the risky drinking is just that you're drinking a little bit above our recommended guidelines.
Okay.
And what we know is that when people choose to drink above those guidelines, they're putting themselves at additional risk. So tell me, what do you think about that?
What is the normal range?
Okay, so again, I'm going to point you up here to this poster. So you would be in this healthy men up to age 65.
Okay.
And So this is the recommended guidelines for someone your age. No more than 4 drinks in any single day or occasion, and no more than 14 drinks in a week.
Okay. That seems okay. I see it as I don't do it every day, so 4 drinks in a day, I don't do that. I may sometimes do 14 drinks in a week.
Yeah.
So I see it as I'm not doing one, but I may do the other, so it kind of balances each other out.
Yeah, so you're kind of thinking, okay, that 4 drinks a day, I go over that a little bit pretty often. But I'm usually keeping it within that 14 drinks a week, so you feel like it's not as bad as it could be.
Right.
And so thinking about those guidelines and thinking about, where you are now and where you might want to be, any changes you would be thinking about making based on that?
Well, after showing me that a shot is actually considered a drink.
Yeah.
So there are occasions that obviously I drink more than that, but so I could see myself maybe cutting back on that and just sticking to beer and keeping it below the recommended amount.
Okay.
But like I said, as you go out with a group of guys, everybody buys around that before you know it, you have 6 or 7 drinks, and it's, you feel obligated to keep buying for everybody too. So it's,
Yeah. So thinking it might be easier to sort of manage that number if you were sticking with the beer.
Right.
And then on the other hand, you're kind of not sure how that would work with your situation because you're typically going out and you drink what
Right.
people
I mean,
buy.
if I was going out with, by myself, then that would be fine. But since, other people are buying you drinks, they don't usually ask what you want. They just show up with drinks. It's hard to tell them no. So.
Yeah, that saying no is hard. And thinking about, for you, it seems like the mixed drinks are going to be harder to manage and keep track of that number
Right.
than the beer.
Well, because every bar is different. They may add more, and so it's hard to really visualize how many you would be having. So.
Yeah, hard to keep track.
Right.
Yeah. And thinking about sort of overall, I think I heard you say that the good stuff about drinking for you is really just that socialization aspect. It's, hanging out with the guys, relax, get away from our women.
Definitely.
Act like men.
Yep.
Watch the game,
Yep.
relax.
Exactly.
And it's just part of that being out with the guys kind of thing.
It's just a time to bond.
Yeah, and it kind of helps cement the evening.
Right.
And on the other hand, there's some times where, like with the canoeing, it can kind of even get in the way of the fun.
Yeah, on rare occasions. I mean, that was one incident. The one incident over the year. I think that's pretty good.
Yeah, it doesn't feel so urgent to you
Right.
because
Yeah.
it hasn't happened really frequently.
Correct.
Yeah. And if you were to want to make a change, what do you think you would want it to look like?
I don't know if I necessarily would make a change. I mean, like I said, I could stick to beer, so that would be one change, which would help keep down the number of drinks.
Yeah.
But I'm not willing to cut back on how often I go out or how much I drink.
Yeah.
So now the incident when we were canoeing, it would have been a little nicer not to have that happen, but it's hard to say if it was the alcohol that caused it, but we were, drinking, so you just assume that. So it's, obviously I would change that. That way we could have continued canoeing for the day. But
Yeah. So looking back at that one instance, you're thinking, if I had a do-over then, maybe I wouldn't drink nearly as much, and maybe I'd, encourage the guys to. We just wouldn't bring as much alcohol, or wouldn't bring any.
I don't know
or
if we
just
could
be
do
planful.
that. Yeah.
You're not sure if you could have fun without alcohol.
In the canoe, it's just something you do. It's a nice
Yeah.
sunny day. It's enjoyable.
Yeah, feels like part of the
It does.
part of the event. Yeah. So not really sure that you're super interested in making any changes. If you were to make a change, one thing you might consider is sticking to beer so you can keep track a little better and at least have that awareness of how much am I drinking.
Yeah, I mean that sounds more of a achievable goal.
Yeah.
Not saying that it's something I'm interested in doing right now, but it's, if I needed to cut back, that would be probably the first place I would start.
Yeah. And I wonder, what would it be like? So you said if I needed to cut back, what kinds of things would have you feeling like, okay, here's a sign that I do need to cut back? What would that be like? What kind of stuff for you?
Obviously, if you get in trouble legally, that would be a big thing. Getting into altercations at the bar, not remembering the night before, that stuff would make me have to reassess if I needed to change my habits.
Yeah, so those kinds of things would be big red flags for
Right.
you that, hey, it's really time to seriously consider making a change.
Right.
If you were having legal problems, getting a DUI,
Mhm.
getting in fights, that kind of stuff.
Right. Yeah, and that's never been a problem. I don't see it being a problem, but I think that's what it would take for me to change my drinking habits.
Yeah, so you're really aware of what the risks of drinking too much alcohol are, and you feel like you've got a good, sort of good head on your shoulders, and you're able to notice if any of that stuff's creeping into your life, then you
Right.
decide to make a change.
Yeah, and I feel like I'm a strong enough person that I'd be able to nip it before it got out of control.
Yeah, yeah. So it sounds like for you, where you're at right now is maybe just having a little increased awareness about those numbers, and even paying attention when you're drinking mixed drinks. We're kind of knowing, oh, hey, this isn't just one drink. It's 6 or 4.
Yeah, I mean, the
or whatever.
information is definitely new, and
Yeah.
I'll definitely think about it when I'm drinking.
Yeah.
Like I said, I don't know if it will change exactly what I'm going to do, but it'll definitely be in my mind, and next time I have a mixed drink, I'll probably think about how many drinks would this actually be.
Yeah. So not sure you're gonna do anything different about it, but at least you're thinking about it now.
Yeah, definitely.
Well, good. Well, I really appreciate you spending the time to talk to me. I'm sure your provider, she'll be in just a minute. One last question. I wonder, what I typically like to do is just give people a call about 6 weeks out from when I talk to them.
Okay.
Would it be all right if I just give you a call just to check in, say, hey, have you had any questions, anything come up, anything else you've been thinking about based on our conversation?
Sure. Yeah,
Okay.
That's fine.
All right, so I will give you a call. In the meantime, I will leave you with my card, and then on the back side of the card, it has these drinking recommendations.
Okay.
So just to help you kind of keep them in mind.
All right.
And I'll leave that with the MA, and so when she gives you all the rest of your paperwork, you'll have that as well.
Perfect. Thank
Okay?
you.
All right, thanks for talking
you
to me
very
today,
much.
Josh.
As is the case with many people drinking in an at-risk way, he did not see a need to stop completely, yet he was willing to consider drinking in a less risky way. Mia's style allowed the patient to consider his drinking without raising his defensiveness.